Today I'm going to be talking about facial aesthetic surgeries. There is also another technique called High SMAS facelift technique. This is also a type of deep plane facelift technique, but I rarely do it nowadays because when I do an extended deep plane facelift, I have all the advantages of a High SMAS facelift technique. High SMAS facelift has a direct effect for mid-face lift. So when I do an extended deep plane facelift, when I arrange the vector and then when I release all the attachments, actually I have the same effect of an High SMAS facelift technique. So I prefer an extended deep plane facelift over a High SMAS facelift technique because I can use all the advantages of High SMAS facelift technique. A lot of patients ask me about mini facelift. Mini facelift is so-called mini. There is a mini incision here. Actually, this incision is almost as the same length as a deep plane facelift incision. So actually, the scar is almost the same in length. However, in a mini facelift, we don't raise the deep tissues called SMAS, but we just pull the skin. So we cannot lift the wrinkles around the mouth and the jawline. So it just has a mini effect like that. And because we cannot suspend the deep tissues, the scar generally heals very bad. So this is the disadvantage of a mini facelift. So in my practice, I rarely use a mini facelift. And another question which is frequently asked to me is why a deep plane facelift is more expensive or why it requires more expertise. The reason is when we go to the deep tissues in the face, we encounter a lot of nerves in the face, and this requires expertise. So we need to dissect all the nerves and protect them so we don't have a facial palsy and lift the tissues up. So that's why it requires more expertise. The reason I'm very comfortable in this field is because I do a lot of reconstructive surgeries in the face as well, including head and neck cancer reconstruction, facial palsy surgery, including muscle transplant to the face, and nerve transfers and nerve repairs. That's why I'm very comfortable doing extended deep plane facelift, and I do see a lot of nerves in the face and protect them all. After a facelift surgery, generally our patients stay 1 night or 2 nights in the hospital, depending on the extent of the facial surgery, and then we discharge them and we routinely see them every day in the hotel. For those who come from the States, I suggest staying here 10 days after the surgery, and for those who come from Europe, I suggest at least 7 days after the surgery.